Tonight you get an extra hour of sleep because, of course, we turn our clocks back for daylight saving time. That means shorter days, which can seriously affect your mood. Dr. Sheela is a clinical psychologist and author of the book Overcoming Trauma and PTSD. She joins us now on the show to show us how we can win the battle of the winter blues. Sometimes it's nice to get started to prepare for all of this, but what would you say people can do right now, sort of starting off for just to kind of battle it?
Yeah, it's a great time to be, thinking about planning and paying attention to our bodies a little bit more. I think the two most important things we can do tonight are, first of all, lay off the alcohol and the caffeine especially right before bedtime or in the evening hours today. And then the other important thing we can do is all of our cell phones, our iPods, all our electronic devices put off this blue light, right, which is fairly stimulating to the brain. And when we have that in our bedrooms and when we use that an hour before bedtime, it interrupts our sleep cycle. And that's something we can do all the year round, not just tonight.
Well, I was just going to say, we have a U-verse changer, if you will, and we have to cover it up because it bothers me. I mean, with this shift, it's tough anyways to get to sleep, but it really does make a difference. It's amazing how you're still alert a little bit.
It's probably one of the most important things people can do the year round.
And you also said on there, I don't want to miss this point, to change your clock before you go to bed tonight.
Yes, that way, you give yourself a little bit of extra time to be able to adjust mentally.
And then what happens after today and when you have trouble adjusting to the time? Because I feel like it takes like maybe 2 to 3 days before you're...
That's fairly normal, 2 to 3 days. And I would say, for people who struggle with any kind of time change back and forth, try to get outside about, I would say, 30 to 40 minutes after you get up, because what that helps do is regulate our melatonin levels and our other stress hormones. Exercise, that's a huge thing that we can do that's really important. And that exercise can be indoor or outdoor, but it helps regulate serotonin and other brain chemicals, which, help regulate our moods on a regular basis. And the small thing you can do is just bring the outdoors inside, whether it's shells or flowers or other things you enjoy as we have less daylight outside, to remind ourselves of nature.
Well, this is a great tip. We thank you for joining us this morning for these, because you know what, it does come down to remembering to do all that stuff, and hopefully by Wednesday we're all back on track.
Absolutely. Thank you.
Thank you, Dr. Raja.